Well, welcome back, everyone. Today we're looking at a new non-invasive way to evaluate heart disease called HeartFlow. Now, joining us to explain more is Dr. Makwana. He's a cardiologist with the Lima Memorial Health System Heart and Vascular Institute. So, thanks so much for joining us, Doctor.
Thanks for having me, Chris. I'm happy to be here to talk about this new technology.
Yeah, so can you explain what is HeartFlow and how does it differ from the other methods of evaluating heart disease?
Sure. So basically, HeartFlow is an advanced technology. It's non-invasive. And what it does, basically, it creates a 3D model of your heart structures based on your heart scan. And based on that model, you can find out the blockages of your heart arteries or heart circulation causing trouble or not. And it's different from traditional technique because in traditional technique, we basically go from the wrist or the groin, we go up to the heart with a tiny tube and take pictures. And based on the findings, we decide whether you need to stand or not. But remember, this is an invasive procedure, the traditional, and there's always a risk involved with that. HeartFlow is different. HeartFlow is non-invasive. Basically, we just do simple CAT scan of your heart and then combine those pictures with AI technique and come up with a plan whether your blockages are stable or not, whether they need to be fixed or not. So definitely, it's a more simple way to find out about blockages. Is safe for the patient and is faster.
Yeah. So who would be a good candidate for a HeartFlow assessment? And also, how does the test work? Does it need does it require a referral?
Yeah, so I'll make it simple for you. Basically, if anybody has chest pain or shortness, or fatigue, or tiredness, cardiac symptoms, and if your doctor is not 100% sure that this is related to heart or not, this is the perfect test for that. You don't need a referral. Primary care provider can order that or cardiologist can order that. And the way it works, basically patient is scheduled for the procedure for the simple cardiac scan. We do heart scan, patient goes home. We send those images to HeartFlow team. And with the supercomputers and help of AI, they create a 3D model. And based on that model, as I mentioned before, we can figure out that if you have blockage in your heart arteries, they are bad enough to be fixed or just treat with medicines.
So if someone has concerns about their heart, how can they get in to see your team, especially right away?
Yeah, so as I mentioned in my previous interviews, that this is a really very unique offer from Lima Memorial Hospital that you can see a heart doctor same day, which is not very common in the country. If you need to see a heart doctor, if you're concerned about your heart, if you have some risk factors like family history, diabetes, blood pressure, if you have symptoms and you are concerned about it and you want to see a heart doctor, call my office. There's a number on the screen and we will make sure that we have 8 doctors, we'll make sure that one of our heart doctor will see you same day.
All right, fantastic. Well, doctor, I really appreciate you coming on the show today.
Thank you. Thank you for having me.
All right, well, don't go away because we have more when we return.